Hi, I'm Dr. Zev Kaufman. Have you ever thought about what happens when a case starts and cannot be properly finished? Not all treatment plans go as planned or according to the plan. So this patient showed up in my office over a decade ago saying that she's not happy with the work that her dentist is doing. And I see that a lot in my practice as a prosthodontics because sometimes people start and bite off a bit more than they can chew. Naturally, she doesn't like the look of the provisional work, the temporaries. Not only are they discolored and misshapen, but they don't support her lip. You can see right here, there's a void. When she opened the mouth, this is what I saw. Remember, this was done over a decade ago, and at the time, the technology was a bit different. At the time, we believed that each tooth has to be replaced by an implant. Today, we know that that's not correct. As a matter of fact, it's better sometimes to create a bridge and we can get a much nicer result. One of the problems here is that she has a single implant for every tooth. And the problem is that they're not all placed in the same plane. You can see here when I finally took off the restorations that the implants are placed one forward, one back, one without tissue, one with tissue, and that creates a restorative dilemma. So as usual, we start with a nice set of provisional restorations. You can see right here, my technician added pink acrylic so we can fill in the voids. And these are provisionals made out of acrylic. We also have this thick strap across the palate to help us stabilize it so the teeth come out nice and straight. So we go ahead and take off all the restorations, prepare the teeth and cut them down properly, and go ahead and reline the provisional to fit. At this point, I'm going to go to the lab, outline the teeth, and go ahead and trim all the extra out. We also had a couple of implants that were still at their integration stage and we needed to uncover them. And you can see how these implants right here are not exactly in the right position. This is how the patient goes home after the first visit. And obviously she's numb here, but you can see that the result is absolutely gorgeous. Notice that after the first day, while she's still anesthetized and her lip is numb, you can see that she has excellent lip support and the teeth are vertical. Right here, you can see that. And that's the way it should be. 2 weeks go by, she returns for the post-op, and this is what it looks like. You might say, I don't like the tissue around it, that it's not perfect. But you have to remember, there's a big deficit right here, and we had to put back some pink acrylic. And this is why today, I wouldn't place 4 implants in the front, but I would only place 2 and fill this in with a bridge with pink ceramic to make the teeth look gorgeous. So here we are taking our impression. Remember, this is over a decade ago, so the age of digital wasn't quite ready yet. And this is what an impression looks like. And my technician fabricates the metal framework. Again, this is a long time ago, so we used to make crowns with a base of high noble metal and porcelain covering them. But first, we have to make sure that everything fits. We use some acrylic and bite registration material to make sure that the height of the face is correct, so when we make the porcelain, we can get proper anatomy at the proper height, and so the muscles are nice and relaxed. This is the try-and smile. The porcelain is not glazed, so it's not shiny, but we can make adjustments aesthetically to make sure that she likes her smile. And these are the final restorations. You can see that we added pink porcelain to the teeth. This way, when she smiles, if she does show any gum, she will show the pink ceramic rather than a black hole. Also, take a look at the beautiful lip support. And again, you're looking at a decade-old post-op. So these teeth were restored over 10 years ago, and this is what they look like today. And when she smiles, she's charming and beautiful. So that is what full reconstruction is. Using implants and natural teeth to create a smile and to give somebody their youth back.